Today we go talk about HER2 positive breast cancer. Na one of the 4 types of breast cancer wey dey. By the end of this video, you go sabi wetin HER2 positive breast cancer mean. You go also understand why e fit change your treatment journey. When we apply targeted therapy, last we go talk about the side effects and wetin fit happen later. You go get better knowledge wey go help you manage am well. If we check wetin dey for Nigeria now, for 2022, about 32,000 women get breast cancer, and 20% of dem cases na HER2 positive. That one mean say over 6,000 Nigerian women for 2022 get HER2 positive breast cancer. But the wahala be say even as we dey use histology diagnosis cancer, plenty hospitals and states no dey ask for the important test wey dey call immunohistochemistry. Or many women no fit afford am. But this test na compulsory. E no be optional at all, because na this test go tell us the type of cancer wey dey deal with. E go help us know if the cancer dey aggressive or not. E help us choose correct treatment. To know if person HER2 positive, dem must do immunohistochemistry test. Breast cancer no be one kind disease. According to immunohistochemistry test, we get 4 types. Today we go focus on HER2 positive subtype, but how e dey behave different from others. Because if dem tell you say you get HER2 positive breast cancer, you fit dey wonder how e different from the rest. All breast cells get protein wey dem call HER2, human epidermal growth factor receptor 2. Normally, this HER2 dey help breast cell grow and repair. But sometimes the HER2 go too plenty because of gene wahala. If e too much, e go make cancer cell grow anyhow, and na that one make that cancer dey aggressive. HER2 positive breast cancer mean say HER2 protein too plenty for body. This extra protein dey push cancer to grow and spread fast. E dey happen for about 20% of breast cancer cases. But better news be say treatment dey. We get drugs wey dey target the HER2 protein. This drug dey slow how HER2 protein and cancer cells dey grow. The goal na to stop cancer from spreading fast. Even though HER2 positive dey aggressive, we get life-saving treatment. Dis treatment dey damage the HER2 protein. Targeted therapy don change everything for women wey dey get dis type of cancer. We no dey use the same chemo like other types. HER2 positives get special chemo combinations. Drugs like trastuzumab, epcetin, Perjeta, and others dey help. Once we know your HER2 positive, we go target the HER2 cells well. We go reduce risk say e go come back. We go slow the cancer and improve your results. So even though e dey sharp, e go still get hope. We dey use one test wey dem call immunohistochemistry. Immunohistochemistry dey help doctors choose treatment and classify the cancer type. We dey enter the cancer cell to check wetin dey fuel the cancer cells. On top dis, we go use 3 markers take talk say you be dis type abi you be dis type. So wetin be the 3 markers? Estrogen receptor, progesterone receptor, and HER2 new receptor. Na dis 3 markers we dey check for immunohistochemistry report. Dis 3 dey help us mix correct medicine. But we go talk about them after. Now, the immunohistochemistry go show how many HER2 receptor dey for the cancer cell. Remember I talk say HER2 receptor na normal cells wey every woman get. But when excess HER2 cell dey for cancer patient body, we go talk say she get HER2 positive breast cancer. When we look the immunohistochemistry report, we dey look HER2. If HER2 show 3+, e mean say na HER2 positive and HER2 cell too plenty. Breast cancer get 4 molecular subtypes. Imagine am like garden with different weeds. Some dey grow fast, some slow, some dey affected by different weed killers. Make we talk about the second type of breast cancer. Na wetin we dey call HER2 positive. For this one, estrogen and progesterone receptor dey negative. E mean say the cancer cell no dey get power from these hormone receptors. But HER2 protein dey positive. E mean say plenty cancer cells go dey produce. HER2 positive breast cancer sometimes dey divide fast and e fit dey strong. So we go need block HER2 protein to slow the cancer down, make e no spread. So the second type na wetin we call HER2 positive breast cancer. The third type of breast cancer na wetin we dey call Lumina B. Lumina B mean say 3 receptors: estrogen, progesterone, and HER2 dey positive. Breast cancer cells dey grow from estrogen and progesterone, so we must block am. HER2 dey also power the cancer, so we must also block am too. Only immunohistochemistry fit tell us if these things dey positive. E go also help us know say if we wan block these 3 receptors, we go need use 2 types of treatment. So we go use both hormone treatment and targeted therapy. 4th type of breast cancer na lumina A. For lumina A cancer, e mean say estrogen and progesterone receptor dey positive and HER2 dey negative. So women wey get this type of cancer go need hormonal therapy, but dem no need target therapy because HER2 dey negative. And we sabi all of this because of immunohistochemistry test. E dey important make you sabi your immunohistochemistry report to sabi your subtypes. Whichever one you get, e dey critical make you discuss with your doctor and make your doctor give the correct treatment for your subtypes, and make e introduce targeted therapies if you dey HER2 positive. If you get small breast tumor or early stage cancer, make you get chemotherapy and target therapy before surgery. Plenty times for breast cancer cases, and when e dey for stage 1, we dey do surgery first. But if you dey HER2 positive, we dey seriously advise make you get chemotherapy and targeted therapy before surgery. The breast sample wey we dey take for biopsy or after surgery na the same sample we dey use for immunohistochemistry, so we no dey take brand new samples. Na the same sample we dey take to make histology diagnosis wey we dey use for the immunohistochemistry. Na pathologist be the cancer specialist wey dey look this sample for lab. This test dey take between 5 days and 4 weeks. We talk say HER2 positive breast cancer get power because normally HER2 cells dey every woman breast, and na dem dey make cells grow. Dem dey make cells grow for breast. But when breast cancer dey, dem dey become plenty pass normal. And when dem dey plenty pass normal, dem dey make abnormal cancer cells to become too much. And if cancer cells plenty for breast, risk dey high say dem go travel far or spread. Targeted therapy dey expensive because for Nigeria, most people dey worry if they fit pay by themselves. So person from brands go help you check the options to take pay on the brand's platform. For this page, you go see different government programs wey dey support women to get targeted therapy for Nigeria. Na 20 years ago dem discover new thing for HER2 positive breast cancer, and na introduction of new medicine wey dem target the HER2 protein. We don know since say HER2 positive breast cancer na strong type of breast cancer, but we no get any medicine wey fit target am. Now we don discover this special medicine, and dem dey target the HER2 protein, and dem dey reduce the power of the cancer, and dem no dey allow am grow fast. So the treatment result dey better. Plenty drugs dey. The first one na trastuzumab, dem dey call am Herceptin. Na the first targeted therapy for HER2 positive breast cancer. Na drip dem dey take give am. The second targeted therapy na pertuzumab, dem call am Perjeta. Dem dey use am with trastuzumab as drip. Sometimes dem dey combine the two for one injection. Dem fit give am under skin. Another type of targeted therapy na the TDM1 wey dem dey call Kadcyla. Na combination of trastuzumab and chemotherapy for one medicine. Dem dey use am if cancer come back after dem don treat am before. Another type of targeted therapy for HER2 positive breast cancer na new drug wey dem dey call Tucatinib or Tuxia. Dem dey use am when cancer dey spread to other organs including brain. So for HER2 positive breast cancer, many targeted therapy dey to slow down the cancer and to take control of this cancer. We sabi say this treatment don change HER2 positive breast cancer from disease wey get power to one wey we fit treat. You fit dey wonder what about chemotherapy, radiation, surgery and other treatment. HER2 positive breast cancer patients dey normally receive combination of treatments. Surgery, removing tumor na part of dem. E fit be lumpectomy or mastectomy. Chemotherapy get wetin e dey do. In fact, we dey use one kind chemotherapy for HER2 positive breast cancer. We dey use am with targeted therapy take make the tumor small. Even sef, radiotherapy dey help comot any cancer cell wey remain after surgery. Shey targeted therapy dey cause side effects? Like all treatment, targeted therapy and chemotherapy dey get side effects. You fit dey feel fever when your body dey hot pass normal, or you fit dey catch cold. Na sign say you dey fight infection. You fit feel say you wan vomit, or belle fit dey turn you but you no dey vomit. E dey do like make you just sit down for one place. To vomit na another side effect for chemotherapy and targeted therapy. Your body fit do one kind for the place when dem give chemotherapy or targeted therapy. Your skin color fit change for the place when dem give you injection. Some patients dey purge, so your pupil go dey water and you go dey go toilet pass before. Sometimes people dey get infection after chemotherapy and targeted therapy. Some people dey get cough, headache, some dey tired. When we look some people blood level, the white blood cell wey we call neutrophil dey low, or their blood level dey low. The side effect wey dey look for targeted therapy na the one wey concern heart. Before you start targeted therapy, your doctor go check your heart with ECG and echo scan. Normally e no dey disturb heart, but we dey always check your heart when you dey do target therapy. One important thing wey you fit do when you dey on chemotherapy and target therapy for HER2 breast cancer treatment na to track your side effects. And when you dey on the brand program, you go fit use the ProScare app. The app go help you track your symptoms and report how your body dey feel. Your doctors go fit advise you and dem go dey with you to help you sabi which steps you suppose take care of yourself and if you go need come for checkup.